welcome everyone. My name is Manisha Thomas with PHAP, and I am pleased to be able to facilitate this fifth session out of 6 during the Humanitarian Networks and Partnerships Week. And the sessions are all around accountability to affected populations and bringing about the participation revolution that was envisaged by the Grand Bargain. This is the 5th of 6 events. We've already done 4 this week. Those are all available online, so you can see the recordings of those. We started on Monday with a session on Every Contact Counts, intentional accountability through the program cycle, where we really looked at how do we make sure that every humanitarian worker who engages with a person from an affected population sees that as an opportunity for feedback and inclusion, and making sure that that's part of the accountability circle. On Tuesday, we had 2 sessions, one on accountability to affected populations and humanitarian data responsibility, and looking at how the data world and the AAP worlds could really work together and complement each other and learn from each other as well. And then in the afternoon, we had a session on leveraging social sciences for community engagement in humanitarian action, and how social science approaches and research can help us really understand the needs of the population as well. Yesterday, we looked at empowering frontline staff to deliver accountable and locally driven humanitarian assistance, where we really focused on the findings of research that was done by IRC, looking at how we're not adequately changing our organizational systems and culture to really value the inputs and opinions of frontline staff, who are the ones who are directly engaging with affected populations on a daily basis. So how we really need to be making decisions much more with frontline staff and ensuring that they're part of proposals and able to provide feedback to individuals within the community as well. And today, with the launch of the Accountability and Inclusion Helpdesk, we're on the last of our virtual ones. We have our 6th hybrid session on Monday about what should we change for greater accountability to people in crisis. And that will be at 4:00. So hopefully we can see you there as well. So turning to today's session on the launch of the Accountability and Inclusion Helpdesk, or the A&I Helpdesk, not to be confused with artificial intelligence, not AI, but A&I. This is just a relaunch, actually. It's not a brand new help desk. It's something that existed previously under the IASC Results Group 2, but this is sort of a relaunch of it. So we'll see a little bit more what the changes are being made. But it's really something that will be useful for anyone working on accountability to affected populations and inclusion. And it will be really helpful in terms of helping individuals, practitioners, and in organizations to really understand what they can do if they've got some questions or they're needing some tools or guidance. The help desk is a place to find those. Sorry, I've come back to Geneva and my allergies are really bad, so I will perhaps be coughing at various points as my asthma is kicking in. I apologize. I'm not going to go too much into how the task force has set up the help desk, because I know Jesse's going to do that. So let me first introduce our speakers. We're going to start first with Jesse Wood, who is Chief of Emergencies and Transitions at the World Food Program. And Jesse is also a co-chair of the Interagency Standing Committee Task Force on Accountability to Affected Populations, or AAP. We then are going to turn to Pedro Freire, who is Senior Information and Knowledge Management Officer, IASC Accountability and Inclusion Portal Manager, who's going to be talking to us about the portal, because we're talking not only about the help desk, but also the portal where you can get a number of resources. Then we're going to turn to Namita Rao, who is the IASC A&I Help Desk Coordinator, who's going to be talking to us about the relaunched help desk. We're then going to go and actually bring in some individuals from other help desks so that we get a sense of how do help desks work, what are some of the things that we could be doing across the different help desks together, perhaps, really getting a sense of how useful they've been in other contexts, since this is a relatively revisioned sort of service on accountability and inclusion. So to get a sense of what are some of the things that work well or don't, some challenges, how can we also learn from those other experiences? And for that, we're going to have Joanne Creighton, who is Senior Technical Expert and Principal Consultant for gender-based violence in emergencies and the program director of the gender-based violence area of responsibility help desk. I'm trying to avoid as many acronyms as possible. Then we're going to have Karina Cliven, who is Senior Education Cluster Coordinator, who's going to be talking to us also about the Education Cluster Help Desk. And then we're going to have Ghulam Hous, who is IASC Humanitarian Advisor on Protection from Sexual Exploitation and Abuse and Harassment. I think I put too many ands in there, but PSEAH. So Ghulam is going to be talking to us about the PSEA sort of help desk, since it's it used to be all together under the previous results group, but now it's been split into different task forces. So Ghulam will talk to us a little bit about that. So before we start looking at the help desk and the portal, I'm going to turn to you, Jesse, to give us a little bit of a background of why this is coming under the IAC Task Force 2 on accountability to affected populations, please.
Thanks so much, Manisha, and I hope everybody can hear me clearly. And thanks also for everybody to join today, and for our great panelists and presenters that are coming up, because it really is a critical issue and a fantastic tool to help translate the collective accountability agenda into operational practice. And of course, that's what the task force, the IAC Task Force 2 on collective accountability, has been set up to do. We're sort of standing on the very broad shoulders of the work that has come previously, particularly the Results Group 2. In the previous iteration, which worked quite effectively to develop a number of tools, mechanisms, things like this help desk, which we really feel we're in a position now to really drive out into operations and hopefully change the way that we work collectively. So the portal and the help desk are integral parts of the overall work streams that the task force is taking forward over this coming year, which include, just to give a little bit of visibility to the task force and the various work that we're doing, really to drive a more accountable leadership at the HCT level. So looking at HCT compacts, leadership training, helping countries to use the tools that the task force has already developed, like the accountability framework, to develop effective operational plans at the country level. We're also looking at how we strengthen the overall humanitarian system, particularly by elevating the voices of affected people, both through CFMs, but also representation and decision-making for. And then a third pillar will be around quality resourcing, looking at how we ensure that the funding is available from donors at the right levels and the right amounts, as well as the technical expertise that's required. And so both the portal and the help desk are sort of integral tools that are being made available to our colleagues at the field level to really work through in their own planning of how to put these accountability objectives into practice. And so the tool, the help desk, is a simple tool that follows a sort of a standard help desk format, and it gives practitioners access to a team of accountability and inclusion advisors who can support you to make accountability and inclusion a reality within your programs. The help desk is housed within the ANI portal, and it's especially useful if it's used alongside the service directory, which is a tool that points practitioners to organizations and groups that can support the implementation of the ANI standards. And this, of course, plays an important role in demystifying accountability and inclusion at the country level, building confidence among partners and building plans to mainstream accountability and inclusion, and flagging strategic priorities to inform future IASC AAP work plans. And so it's really a critical session. I'm very glad that everybody is dialed in, and I'll leave it to Pedro and the other experts online to take everybody through the portal and the help desk and have a good conversation about how we can use this fantastic tool to bring our aspirations to reality. So thank you very much, Manisha.
Thanks so much, Jesse. And I think it's great that the task force is being able to do so many things, as well as really focus on responding to the needs of practitioners. And actually, I forgot to mention in the opening that last year during the HNPW AAP sessions, this was actually a call from practitioners to have this kind of support and help. And so it's been great to see that the task force has picked up on that request from last year and is now putting it in action. So we can see progress being made already, which is always wonderful. Thanks so much, Jesse. before I turn to Pedro, who's going to talk about the portal, we're going to do a bit of a poll, a Zoom poll, and we've got a few questions for you, and that'll be up while Pedro's talking, and then we'll come back to look at the answers once the poll has been done and once Pedro's finished, sorry. So the questions are, have you already used the IASC Accountability and Inclusion Resources Portal? There's a few options there. What kind of resources offered on the portal are you mainly looking for? So pick up to 3 there, please. And then the third question is, are there any other types of resources that would be helpful in your work? So that can also give our colleagues in the ISC options and ideas of what they might be able to bring to you in the future. So please take a look at the poll and do answer those questions, and we'll come back to that. And Pedro, I'm going to turn over to you, please, to introduce the A&I portal. Thanks.
I hope you can hear me. Thank you so much, Manisha. Okay, perfect. Let me start with a couple of thank you notes. I think they are in you, Manisha, Marcos, and PHAP for all the support in preparing these sessions and the moderation. A special thank you also for my colleagues and panelists. It's a pleasure to be here with you. And most of all, many thanks to everyone out there on the audience for joining us today. So I will be presenting the portal before Namita presents the help desk. And the idea is to give you a very brief overview just so that you understand what we have in place and what we are changing now. So the portal is intended to be the go-to place for practitioners and leaders who strive to implement people-centered approaches. And we are doing it by covering accountability to affected populations, community engagement, risk communication, complaints and feedback mechanisms, and all the areas of inclusion, age, gender, disabilities, and other diversity. So we want to be the go-to place, a centralization portal for all the resources out there regarding these important areas. And in terms of history, the Accountability and Inclusion Portal was developed by the Interagency Standing Committee, Results Group 2 at the time, on accountability and inclusion. And this is the results group that gave place to the existing Task Force number 2 on accountability to affected populations. So the portal was launched in September 2020 and includes a resources library that allows users to access and share resources, rate them, and leave comments, a help desk that provides rapid advice and support from experts, as Namita will explain, a blog page that features thematic articles, and a service directory that signposts users to available expertise across organizations to implement people-centered approaches. Back then, during the times of the Results Group 2, the Results Group was being co-chaired by UNICEF and UNHCR. And UNICEF was the one leading the development of this deliverable. So the portal was then developed in collaboration with the Active Learning Network for Accountability and Performance in Humanitarian Action, also known as ALNAP, and uses ALNAP well-established portal system. UNICEF covered the costs to personalize the portal and develop the resource rating function, but nowadays the maintenance costs are supported and covered by ALNAP. So we would also take the opportunity to thanks once again the generosity of all the partners that supported and are currently supporting the existence of the portal and the help desk. That being said, and before moving to a brief demo of the portal itself, I would like just to present some statistics on the portal usage so far since September 2020. We have had around 57,000 views, which represents an average of 63 visits per day. You can also see the most downloaded reports and blog posts. And you can see these are somewhat modest numbers, modest metrics. And that's when thing that we would like to request from you is to help us in terms of sharing the existence of this portal through your organizations and through your networks. We want to make these resources available to as many practitioners as possible, to make sure that we implement the change on the ground that we want to see. In terms of geographical coverage, we can also see that the location from where our users are logging in, there's a concentration around Europe and North America, as well as in the big humanitarian responses like Bangladesh, Ethiopia, Nigeria, Iraq, Afghanistan, which means that we still have some work to do, again, in terms of advertising the portal and making it useful for the practitioners in the not so mediatic locations. And again, we would request your kind support in terms of advocating for the portal through your organizations and networks. Now, without further ado, I will shift to the portal itself. And I want to start by showing you within the LNAP portal that the Accountability and Inclusion portal is one of many portals that LNAP is hosting. So once again, highlighting the great work and support that LNAP is providing. So this is our portal, the IASC Accountability and Inclusion Resources portal. And you will see that we have a homepage where we have some quick links for the library to submit resources or to contact the help desk. And we are highlighting a couple of helpful tools and last examples and some other useful links. And then on the top bar, you have several tabs. So we have a tab for the resources library. And this is where you can search for the resources. You can see currently we have 520 resources here. And the way this works is that you can type your research words and you can filter by the resource type, you can filter by the language you are looking for, or a specific topic within our thematic areas of work, or resources published by specific organizations or from a specific country, etc. So it's a very flexible search engine that will allow you to find what you are looking for. Also to highlight that here you have the possibility to upload your resources as well. So if you want to upload a resource, you can do it also through the portal, and this will be vetted and will be put it online. And we again would request your kindness in terms of sharing resources that your organizations might have developed and making them available for the broader community. We would be very glad to include them in this portal as well. So then we have a section for the blog where you can see the latest blog posts, and these are blogs sharing best practices, case studies, and good examples from our colleagues on the field. And again, you are also very welcome to share some stories and blogs with us. We would be very happy to put them in here as well. Then we have a tab for the service directory, and this was supported by WFP initially, and the service directory intends to give you a search function where you can search for service providers within the areas of accountability and inclusion that are operating in your region. So if you need support, let's say, to do a perception survey or to implement a community feedback mechanism, you can come here and you can search the database and see who are the service providers in your region, in your country, that would be able to provide such services. Yeah, and lastly, we will have the help desk, and this is where I will hand over to Namita. Thank you so much.
No, Pedro, before I hand over to Namita, we're going to look at the poll results, because we've got another poll for Namita's section. So hang on there, Namita, if that's okay. So I hope everybody see the poll results, sorry. So not very many of you have used the portal yet, only 16%, but 80% of you are intending to, which is great. So Pedro, I think you've got lots of people interested in the portal, so wonderful for that. And in terms of the resources that are offered that people are mainly looking for, the highest numbers there are research reports, studies, and case studies, as well as tools, guidance, and methodologies. Also, 51% are looking for practical tools, 27% are looking for guidance, 37% are looking for plans, policy, strategy, or lessons papers, and only 8% are looking for blogs, which is interesting. So I don't know if that means that there's not enough blogs or that people don't have too many blogs to read, but maybe that's something for you to consider, Pedro, about getting people to look at the blogs, or maybe different ways to promote the blog so they see them other ways. That's the first two questions. Oh, and then I closed it by mistake. And then in terms of some of the answers of other resources that people highlighted that they're looking for, someone suggested a tutor on how to use the portal and report activities by organizations, training materials, contacts for practitioners, resources, lessons papers, training like this to continue and at times be physical. Frontline handlers can be given special consideration, more resources about inclusion and intersectional issues, interinstitutional good practices, waiting to learn what the guidelines, what you can learn from successful projects from other regions, indicators and benchmarks, perception surveys, sit reps, and mentoring. So I think there's lots of things that are probably there on the portal, but it's exciting to see that a lot of people are looking forward to using it. And before I introduce you, Namita, I'm going to introduce the poll that we're launching around the A&I help desk. The two questions we've got here are, the first one's a multiple choice. Have you faced situations where you think a dedicated accountability and inclusion help desk would have been useful? And what is one or more situations, questions, or areas on which you would want support from a global level help desk? And that is you can answer that question as well. And with that, now I'm going to pass it over to you, Namita, to talk us through the A&I help desk, please.
Thank you, Manisha, and thanks, Pedro and Jesse, and all those who are part of the panelists. And again, those who are attending the session. This has been a long-awaited relaunch of the help desk, and very happy to present to you all, but also, hear these great insights through the polls, through the Q&A, through the chat, and of course, beyond. I am the Accountability Inclusion Help Desk Coordinator, and the team and I, we are very excited to present this to you. So thank you for joining. Next slide, please. Okay, so what is it? What is its scope, and where does it stand? The Accountability Inclusion Help Desk, first and foremost, it's a global level help desk, and it has been set up by the Interagency Standing Committee to build the capacity of practitioners. And this capacity is on these areas of accountability to affected population and inclusion. So the aim and the purpose is to provide coordinated technical assistance and share key resources to users. Now, again, you don't necessarily have to be from any of the IAC member organizations. You can be from any part of the world, country, regional, global level, and really go ahead and ask questions on these topics. Next slide, please. So who is it meant for? What the help desk offers, it's rapid or in-depth support. So rapid being queries that can typically be answered, say, within 2 days. It's usually requests for a certain type of resource, a guideline, a case study, or some kind of best practices or lessons learned from other regions, other contexts. And in-depth kind of support or queries, that basically means something that would need some more detailed insight from a technical expert or one of the networks that we are connected to. So really providing that a little bit of that extra hand holding, and it might take a week or so to fully respond, given the kind of follow-up that might be needed. So having said that, who can request support? We have international organizations, NGOs, implementing partners, government bodies. But again, the list does not stop here. You can be from an academic institution, a student, or just, you don't have to be from the AAP or the inclusion working stream either. You might be interested in knowing more about it. You're looking to mainstream it within your organization, within your work, and you have some questions that can help you get started. So it's really for everyone and focused on these two particular topics. Next slide, please. And the thematic areas that are being made available through the help desk. So we have AAP itself, we have inclusion, community engagement, complaints and feedback mechanisms, monitoring and evaluation within these two topics, information sharing, and capacity development. So when we look at the value of the help desk, again, this has come through consultations from experiences, what makes a help desk make sense? What can it be used for? So, some of the insights that we gathered, we'd like to present here today. And the 5 of them on the screen really were handpicked to really show what we'd like to, do with the help desk. How would we like to really kind of customize it to support practitioners on ground? So first is providing this type of rapid support. If a question is asked, immediately responding to it, acknowledging it, and letting the user know that we'll get back to them with the appropriate response. Second one is improving the capacity of the user on the query topic. So we really hope that the help desk can help answer or help explain something on the question being asked and really improve the knowledge or the capacity on that particular topic and let the user go back with something new and take it from there. The third point being collective engagement across organizations. We really want to leverage the position that this help desk has, within the ISC, and of course, working closely with different networks. And one of the reasons we also wanted to launch it during HNPW was to really connect with networks and other organizations around to bring that collective engagement, lean on each other, and to prevent duplication, which is something we often see across our area of practice. And the fourth one is strengthening existing systems. Now, again, we don't want this help desk to add a layer of bureaucracy or duplication. We want to strengthen what already exists, at the country or regional level, but really, fill that gap from as a global level help desk. And the fifth point being, we really would like to use it to detect uncovered needs and gaps. Just to give you an example, if we get a request to the help desk and, as the coordinator, I try to, find the appropriate answer or refer it to the right channels. And despite tapping on every single door, we don't find the answer to it. It would be out of scope, essentially. But that is also a good data point for us. It's important for us to know what are some of the needs and gaps, and what do we really need to work on? What can we incorporate in our work plans? What kind of resource can we develop? So these are the 5 points that we really want to highlight to you and what we intend to focus on through this help desk. Next slide, please. So when we talk about its functionality, we again have 3 points to present. So the main idea is to provide rapid and remote technical assistance to users. And this can be done by, sharing of a resource, a guidance document, or knowledge bases within a certain thematic area or topic, or case studies from other regions, lessons learned. And that's why the portal that Pedro presented, it will be really useful for this. Any kind of contribution from your networks would be so helpful in really elevating it further. And the second point is, in addition to this kind of rapid support, we want to provide in-depth support, and that would be done by referring your query, referring that more in-depth, longer response kind of questions to regional or global level experts. And this would essentially mean you would get some additional perspectives, examples, insights from their long experiences in these two fields. And we really want to connect to different networks out there to be a part of this referral system. The third and final point is we really want this help desk mechanism to be holistic, in the sense that we can track the number of queries coming in, the types of queries, so we can identify patterns. So we see a lot of queries coming in on inclusion. We can really put our heads together and deep dive into what exists, connect with others within this field, and help meet this demand that we see coming in. And the three ways in which you can get in touch or access the help desk: we have an email ID. So you can always shoot an email with the details of your query, and we can respond to it. Second one is the contact form. It's basically a similar mechanism as an email, but you would be adding a lot more details one by one, so that we get a complete picture of the context you operate in. And the third one is, of course, the resource library that is a part of the portal. Yes, that's right. This is the website, the help desk webpage within the portal, and you have all three of them linked here. So you can just click on any of those buttons and it'll take you to the appropriate channel. And of course, if you're looking for any other type of global help desk, we really would like to cross promote and bring up other help desks here, just so that you have the right kind of channel in front of you to seek those very specific requests and guidance. Thanks, Pedro. All right, so if we look at now that we presented these to the portal and the help desk, how can we really increase the linkages between the portal, this kind of service mechanism that the help desk provides, and the networks that y'all are a part of? We want to use this conversation, and of course it doesn't stop here. We want to connect with you after this and really see what are some ideas that pop up and how we can work together. So for the purpose to just kickstart this conversation, we would like to present 3 engagement ideas with you. So the first one is the sharing of resources. Maybe Pedro, you can click. Thank you. So yeah, the first one is the sharing of resources. So these can be strategies, tip sheets, guidance documents, case studies, frameworks. Again, the list that we went over during the poll results that Manisha shared, that's also a great insight for us to really understand how we can expand and the resource portal, make it more robust. Of course, the dissemination of the portal and the help desk within your network or your technical working group at a country or a regional level. It can, it would be very helpful to, first of all, share, the existence of these services and resources, but also for this to reach the right potential users. So we would really appreciate that. And the third one is become a part of a community of practice for this help desk. If you think you have some time and you have been working in this field for a while, we would love to hear from you, see how we can bring you into the community of practice and work together on providing this kind of collective technical assistance to users on ground. Well, that's it from me, and thank you so much. I'm here to answer any questions, and over to you, Manisha.
Thanks very much, Namita, and thanks for walking us through what you can get if you do use the help desk. Before I turn to we've got a number of great questions for both of you. And before I do that, I'm just going to quickly turn to the poll results. So those who, when you face, let me try that again. Sometimes people have faced situations where they think a help desk would be useful. So that's about 47%. 36% said yes many times, and 17% said no, not yet. And then we have a lot of situations and areas where people have indicated what they would want in terms of support from a global level help desk. And there's too many of them for me to read all of them, but we will share those with Namita and Pedro so that they're able to dig into that a little bit more. But just a few of the things that came up are things like practical guidance on engaging communities, on how to do inclusion better, on how to deal with feedback that comes from informal channels, how to analyze feedback data, also requests for things like operational support, SOPs, standard operating procedures, terms of reference and developing those, tools and facilities to help kind of ensure access for inclusion so that you're able to really put that inclusion into practice, indicators, research tools, research methodologies, and also advice and actions on strategies and work plan development. So those are just a few that I pulled out from amongst many. So thank you to all of you who provided your input there, and we will definitely be sharing those back with Namita and Pedro. I'm going to just take a few minutes to ask some of the questions that have come up in the chat to the two of you before we turn to our other help desk colleagues. One of the ones around the resource section and also in terms of the experts. What happens when a new resource is submitted? How is it vetted and what kind of quality assurance is there? And I guess linked to that also, who are the global or regional experts and how are they selected? Are they from the UN or NGOs as well? I'll maybe turn to you both on those two, and then I'll go to some more after that.
Maybe
Pedro,
Namita, you can explain the experts first.
Yeah, sure thing. So we have started doing a mapping. So to give you an answer of what we have at the moment, we have the commitment of the IASC task force on AAP, the members from there. We have their commitment to support with technical assistance and at the global level. And we are already in conversation with a couple of networks and, from both the AAP side and the inclusion side. So, but again, the buck doesn't stop here. We want to continue this conversation, and right as HNPW ends, I have a couple of these calls lined up to see how we can really, first of all, understand these areas of commonality, and come together and figure out a way where the larger community, not just, UN agencies, can come on the back end, be a part of the community of practice, and support the help desk. So we've started small, but the intention is to take it beyond that.
Thank you, Namita. And then in terms of vetting and quality assurance for the resources, we are operating on a model where every organization is free and open to upload their resources, but they will, of course, be the responsibles for the resources that they are uploading, meaning that we are not conducting vetting and quality assurance on the resources themselves. But what we will do is we will confirm that the resource is relevant for this specific portal and area of work. And we will confirm that the person that is uploading the resource is an approved representative of that organization or network or whatever it is. I hope it answers.
Yep, thank you so much. There's also a couple of questions about whether or not you're looking at potentially sourcing regular translations into different languages apart from what's already there, if there's any plans around that. And also if you're planning, somebody had asked if you have plans to extend that porthole in Africa, but it's a global portal. So I'm assuming that applies to everywhere. So you can access it no matter what. And I don't think there's nothing that's regionally specific, is there? I mean, I'm sure you can search in the portal by regional or country specific things if you wanted to, but it is a global portal for everyone to use, right?
Yes, indeed. And the language question is extremely pertinent, and we are working on it. We want to extend and have as many languages incorporated in the portal as possible, and we want to have the resources translated in as many languages as possible. The challenge for us as interagency standing committee task force, which are temporary bodies without a budget, is that we rely on the task force members and the broader community contributions to voluntarily either fund the translations or translate themselves. So I think this would be another call for action in terms of if you are a network or an organization deploying AAP in a specific country or region, and you want to see the resources or some of the resources translated, we would be very welcome to support you in going ahead and translating for your region. At the same time, in parallel, we are also working at the global level to do as much translations as possible, working with Translators Without Borders, as well as tapping on the translation capacity that the task force members have within their own organizations. So, for example, WFP is now translating a couple of documents, and ourselves have also translated a couple of documents in our native languages. So it's an ongoing effort, but we need support. Thank you.
Great. Thanks so much, Pedro. There is a question that had come in earlier and also that's kind of here now about the risk of potential duplication. So there's a question in the Q&A now about, I would like to know about duplication with other similar platforms, CDAC's website, the Community Engagement Hub hosted by the British Red Cross, among others. What would you say is the main difference so we can all agree to share our guidelines and resources in the same place? And also one that had come in earlier in the registration form, how do we make sure that we're not creating a parallel system to existing ones or adding unnecessary bureaucracy that could strain already scarce resources? How can the effectiveness and efficiency of the help desk be evaluated to ensure it delivers innovation rather than just complicating existing systems? We have so many platforms that serve this very purpose. Red Cross, Red Crescent Community Engagement Hub, and the Collective Service, just to name a few. So how do we make sure that it's not adding yet another layer of complexity into an already rather complex AAP world?
Yeah, I can take this up. So first of all, to mention that there is, as far as I understand, there is no such platform available at the global level dedicated to accountability to affected populations and inclusion. But again, if they exist, we would like to work together, figure out how we can match our synergies and really be collaborative. Also to say that we really don't want to create an added layer of bureaucracy, but rather we want to reduce it. We are not here to replace existing systems, especially at the country or regional level. Again, this platform is meant for practitioners who are looking for that extra added support, where we can fill needs and gaps for whatever might not exist at the other levels. So, what's working, we want that to work well. We don't want to come in between and confuse users on ground. We just want to have this, extended hand to build capacity and really, keep improving along the way, and that's why the feedback coming from you is so helpful. And also to say that, we are very flexible in making changes along the way. If, there is a suggestion coming from the community, we would really like to hear from you. Also, just to say that, the intention is that every quarter of the year, we want to reflect back on what was done, what were some of the questions that were asked, what are some patterns we are detecting, which regions are asking for questions more than the other, and really kind of address them one by one. So this is something we want to implement throughout the year and as we go forward. And of course, we'll be, we intend to connect with the other help desks that are present here today and, of course, beyond, because there's so many lessons we can learn from them. And we would really like to lean on them to, learn from their experiences, some of the lessons they have learned, some of the kind of good feedback they've received, and see if that's applicable for us. So having this kind of network or a community of help desks for cross referrals is something that I see very helpful, and I would like to take that beyond this conversation today. Thanks.
Super. Thanks so much, Namita and Pedro, for introducing us to the portal and the and the help desk, along with answering those questions. I'm going to turn now to the other help desk. And I know actually there's been a couple of others who've pointed out in the chat. We've got Alice, who is talking about an IHL Center help desk and a community of practice on accountability in World Vision that has a lot of resources. So there's lots of other ones out there, and we might see how we can get something there. But I first want to turn to Joanne, because Joanne, I know you've got to leave quite soon. Thank you so much for joining us, especially on short notice, since I only asked you. We asked you like 2 days ago. Thank you, as well as Gulam asking you yesterday. But Joanne, you're supporting the gender-based violence area of responsibility help desk. That's been running for a little while. What are some of your experiences of running a global level help desk? And what are some of how do you make sure that you're keeping up with the latest resources and thematic topics?
Thank you so much, Manisha. And I think the first thing I would love to say is, if you'll allow me to say how great it is to see the launch of the Accountability and Inclusion Help Desk, and congratulations to all involved in this endeavour. And thank you for inviting me to join you all on this auspicious occasion. So to answer your question, yes, the GBVAOR Help Desk has been running for a number of years now. We're in our 5th year. And so, of course, over that time, we have learned along the way what how to keep improving the service that we're providing, and to try and tune into what our community of GBV specialists and the broader humanitarian community that can access the GBVAOR help desk need and want to see out in terms of resources or support that they need. So I think the first thing to say is that, like the Accountability and Inclusion Help Desk, we are here for humanitarian actors rather than providing that direct support to GBV survivors. Although we never turn survivors away if they should seek our support, and we'll seek to provide them with a safe referral with their informed consent. Like the Accountability Inclusion Help Desk, we're also a free and confidential service. And that is critical, I think. It's so important, and has also been borne out in our learning over the 5 years, that really contributes to a sense of safety and people coming forward to ask for the things that they need help with. And so I think we also have found that it's a kind of continuous evolution in terms of who's contacting us from the humanitarian community, what they're asking for help with, the learning that we also generate as a help desk team in terms of what types of support that we can provide, how we deliver that support based on our available resources and budget, etc. And also, really importantly, the feedback that we receive from those who request our service. So more and more people are getting to hear about us year on year. And so, we saw in 2022, last year, another year of high demand. And I think something just to bear in mind is that I think that this high demand is also mirroring the increasing level of humanitarian crises and the pressures on the humanitarian community to respond to these. So that might be something that's, comes up also for the ANI help desk too. I think in terms of how we stay relevant and really, on our game, so to speak, in terms of thematic topics, again, it's linked to this thing that we've been talking about, which is connectedness. There's a really wonderful community of practice of GBV specialists, and that's sort of independent of the GBVAOR help desk. But it's a really growing, thriving community where people are having a constant conversation on the topics that are coming up for them. And we can tap into that and engage in that dialogue, and also see how, with the resources and expertise that our roster of experts have, how we can support those types of things that are emerging in their conversations. We also have a wonderful steering committee that comprises members from the AOL coordination team, UNICEF. We also, as you know, are part of Social Development Direct, which is a specialized consulting firm with a wealth of experts, rich in expertise and knowledge on specific linked thematic experts that we can tap into. And as usual, you know, as you'd expect me to say, we're signed up to various key mailing lists, relevant academic faculties, UN agencies, feminist networks and institutions, so that we can stay engaged in relevant subject matter areas and make linkages, really importantly, to things that also link across to GBV. And then I think finally, you asked sort of how we stay relevant for practitioners on the ground. And I think, again, links to that connectedness, also being really a committed small help desk team with a broad roster of experts. We can really make sure that we're trying to keep expanding our net of community that we're engaging with. But importantly, we find it's really essential that when we receive a query, if the request is open to it, we always try to have an initial call with them so that we can really hear firsthand what's driving their request, hear more about what they need and what their expectations of our service are, and we can see how we can meet them where they're at and try to honor that as best we can, provided it falls within scope of our help desk, of course. And if it doesn't, we try to link them to other relevant services or help desks that their request would fall in line with. So I think it's really that, plus, as I alluded to earlier, proactively seeking feedback from people who seek our help, reviewing that feedback on a regular basis, taking it on board, and really thinking through what refinement to your service might be needed. And I think reviewing that feedback openly with our steering committee, with our client, with our donor, and also with the wider community through a transparent AOR Help Desk annual report that we publish has been some of our key learning. I hope that's helpful.
Very helpful, Joanne. And it's interesting that you found that point about taking the feedback and adapting and refining is something that's been very helpful. And Namita, I meant to say that's great that you're also going to be doing that with the A&I Inclusion Help Desk, the A&I Help Desk, because I think that's part of, accountability as well, right? It is, you take the feedback and you do something with it and you adjust. You don't just take it and put it away in a back pocket or in a file folder and forget about it. So I think that's really helpful. Joanne, just can I ask you, because I'm just quickly, in terms of the language issue, how have you been able to manage language in different regions? And, the question that kind of came up for the portal and the help desk, how do you manage languages?
It's a great question. And I would say, again, we're a work in progress. We don't have it entirely down, but we do have some key learning in this area. So I think first and foremost, we have an amazing roster of GBV and gender experts. So it includes Arabic speakers, English speakers, French and Spanish speakers, plus a few other languages. But those are the service languages that we advertise that we can provide support in. So if a request comes in that's in scope in one of those languages, or that's seeking support to be provided in one of those languages, we try to match the querier with an expert who can provide that, both in terms of language and expertise. So it's a bit of art and a bit of science going on there. Another way in which we try to support the global humanitarian and donor community in relation to GBV and emergencies is by translating some of our selected GBV AOR Helpdesk products into those key languages that I mentioned. And in addition to those languages, last year we were able to also find a short-term expert to help us with also some translation to Ukrainian language for some relevant products in relation to the Ukraine war. So of course, we are thankful for the resources that we have to operate the help desk, but they are finite. So we are currently able to translate around 6 products per year. So this year, how did we choose which products? So we consulted with that GBV community of practice that I mentioned that has over 1,000 GBV specialists. And we did a very short survey with them, asked them which of our products would they like us to prioritize for translation this year. We then reviewed that, and those are moving forward. So how do we do it? We have a service contract with a specialized translation company, specialized in terms of providing translation to humanitarian actors. I think they were mentioned earlier, Clear Global, formerly Translators Without Borders. And then they really help us with the initial translation. And then we have an additional layer where we have our GBV technical subject matter experts will review that translation that we receive from Clear Global, just to make technical refinement to the product. I would say that there is ever increasing interest and demand for additional translation of our products. And so this remains a real open area of learning for us and continued discussion with our steering committee as we look to try and manage this demand, because it's clearly there in the humanitarian community.
Super. Thanks so much, Joanne. And I think that the link that you have there with the community of practice and that broader group of experts is really key, it seems, to be able to manage the help desk. It's almost like you've got a bit of a dating app, like a dating service between the technical experts who've got the right language, and making those linkages there is really key. And I think it is the fact that you also said that, word of mouth has helped to get more and more interest and more people engaged in the help desk. And I think that's also something with all the different help desks, there's probably the opportunity to kind of reinforce the existence of all of your help desks so that you can encourage people to go to each other's if they're more precise. Joanne, there was a question for you about if you could share your donor if you want. I'm going to let you answer in the chat if you'd like to do that, because I know you've got to run. But thank you so much for joining us, and thank you for running the GBV AOR Help Desk. I'm sure many people have used it who are in the audience today. So I'll let you go, Joanne, but thank you very much. And I'm going to turn now also to Karina and also to Gulam to see if they also have some thoughts on some of those questions. And I know we've also got Alice, who's here from the IHL Help Desk, so maybe she'll want to come in as well, though I know she's on another call, so may not be able to join us. Maybe, Karina, I could ask you, from your experiences, how has it been running the Global Education Cluster Help Desk, and how are you ensuring that you're able to keep up with the latest resources on thematic topics?
Thank you, Manisha, and thanks to everybody joining. So the Global Education Cluster Help Desk is quite an old help desk. We started in 2015, and we started for the same reasons that Namita mentioned, on getting closer contact with our community, which are education cluster staff in national and subnational settings. And also understanding more about the gaps and the needs for the education cluster. So when we launched it, it picked up nicely, but then it kind of flattened out. So we also needed to relaunch our help desk. We did that in 2020. And the past 3 years, we've had annually an average requests, approximately 230 requests per year, covering 44 contexts. This is, we are happy with that. We're able to take in more, but we're happy with that. It found kind of a good level of engagement. But I think a few of the lessons learned that I would also like to pass on to Namita and colleagues is the importance of reminding people all the time of the existence. So we are catering for education cluster staff. So every time we have new people joining the education cluster in the various countries, we tell them about this option. And we also flag it to existing staff. So that I think is something that you need to do on a quite constant basis, not to be forgotten. It's also worked well for us to stress to our users that we have a dedicated person taking care of this help desk. We have a senior knowledge management specialist, Elisa Radisone, and when she's not there, it tends to be me who's manning the help desk. Because we found that there was a kind of shyness among some of our colleagues who felt maybe, are the 20 plus colleagues in the global education cluster, are they reading what I'm writing and are they judging me upon that? Am I adequate or inadequate for my job if I post this question? So having a little bit of a private space, so to speak, that you know who are you actually writing to or speaking with when you contact the help desk, that has been tremendously important. And also stressing that there is no question or request that is too small or too basic. So there's definitely no judgment whatsoever. We are open to it all. Fastness is also important for help desk. We aim for acknowledging the request within 24 hours. Doesn't mean that we necessarily can answer it fully, but at least to acknowledge that we have received it. This is definitely important. We operate in 4 languages: English, French, Spanish, and Arabic. That means that's the communication we can engage in. It doesn't mean that all the materials we have are in those 4 languages, but we, as everybody, are also working more and more on translating. But communication-wise, these are the 4 languages we offer. And then, since we are from the education cluster, we have a series of technical experts, experts on child protection and education in emergency linkages, on safeguarding, on cash and voucher assistance, on localization, on advocacy. So we draw upon all these specialists to when we answer the request or give the support. Let me also mention that we have, over the years, since 2015, built a really great repository of material that we draw upon. And we always encourage our country clusters to share whatever they develop of templates and tools and guidelines. And just to give you a brief example of the usefulness of all the time requesting materials from our community of practice is that our colleagues from the Afghanistan education cluster, they developed a really great earthquake response plan. So we had that in our repository, and then when we, in February, had the earthquake hitting, among other places, northwest Syria, and they requested the help desk for, do you have any examples of response plans? Then we could immediately pull out this that they could then quickly contextualize. I should also say, how do we stay relevant? We have done surveys sent to our users to make sure we are on track. 86% of those who answered were happy with our services, and most of them even thought it was excellent. For those who were less happy, we have followed up to understand more. And see which are the offers that they need. So I think we can say we are very dynamic help desk. We have a lot of interaction with our users, and we take every opportunity we can during trainings, workshops, etc., annual meetings to engage and understand what are their needs. And definitely the help desk is also a key tool for us. How can we opt our game? How can we adapt our work, for instance, develop new guidelines, new tools, new templates, or how can we adapt our capacity development offers? And I think these were some of the important things to share from our work on the Global Education Cluster.
Super. Thanks so much, Karina. And I think that point about, having to remind people that you're there all the time, and similar to what Joanne had said about having that sort of safe space that you can ask questions and no question is too big or too small, is really critical as well. And making sure that people know they can ask you whatever it is, I think is really critical there as well. Maybe Ghulam, I can turn to you, and then maybe I'll come back to you, Karina, if we've got time. And then also Alice, if you're there, maybe you can talk to us also. Marcus can promote you to a panelist and you can talk about the IHL help desk if possible. But Ghulam, in terms of the protection from sexual exploitation, abuse, and harassment, how are you providing field support to practitioners? And are there plans to establish a PSEA help desk?
Manisha, thank you so very much, and hi everyone. So as things stand now, PSEA is relatively a new area of work that we are expanding in its space. Currently, we do manage the community practice of the interagency PSEA coordinators and provide them with the technical support and policy guidance, and that usually happens through one-on-one. And the interagency PSEA coordinators, they then in turn operationalize that guidance through the interagency PSEA network members that they have in their own countries. So our prime audience is the interagency PSEA coordinators, and we have so far about 20 interagency PSEA coordinators deployed in the humanitarian settings. Indeed, we have a plan to establish a joint help desk together with the Office of Special Coordinator on Improving the UN Response to Sexual Exploitation and Abuse, that is the Christian Saunders Office, to provide coordinated and expedited policy guidance and technical support. The idea of setting up the help desk actually came from the interagency PSEA coordinators during the annual workshop, the Technical IAC PSEH workshop that we held in Nairobi in January this year. And we started working with the Office of Special Coordinator on improving the UN response so that the coverage of this help desk goes beyond the humanitarian settings and also covers the development and peacekeeping settings. We recently concluded the consultations with the stakeholders, and now the guidance note will be rolled out for the stakeholders, and we do plan to establish the hotline, the help desk, to start providing the services to the primary audience, that is the interagency PSEA coordinators. Back to you, Alicia.
Super. Thanks very much, Ghulam. And so when that help desk is going to be put in place, is it just going to be for coordinators, or could it also be for PSEA focal points in organizations, like an NGO, for example?
So the idea is that the PSEA focal points and the PSEA specialists deployed in individual agencies, they receive guidance from their respective headquarters or thematic leads. We will primarily provide technical guidance and policy guidance to the intra-agency PSEA coordinators deployed in support of the humanitarian coordinators and the HCTs.
Super. Thanks very much. I might come back to you, Ghulam, but I understand, Alice, you might be online to maybe give us some perspectives on running the IHL help desk. Hi, Alice. Hi. Could you introduce yourself, please? And thank you for sharing your help desk. It's nice to have all these help desk people together.
Well, thank you for letting me gate crash your meeting. So yes, my name is Alice Priddy, and I'm a senior legal advisor and the manager of the global desk for the Diakonia IHL Centre. I'm based in Geneva. And we at the centre also have a help desk. Our help desk is focused on the laws of armed conflict. But within the centre, we very much take the approach that international humanitarian law, which is the body of law that applies during armed conflict, must serve to provide a protection for the entirety of the affected population. So therefore, we take a very inclusive approach to our interpretation and application of the laws of armed conflict. We have particular expertise within disability, age, and gender. And our help desk support provides inclusive advice on that body of law to humanitarian actors. I would just mirror what other colleagues who've spoken before me have said, is that our approach is to be adaptive. It depends on the actor that's seeking our advice. Sometimes there'll be actors who have a very high level of capacity in relation to the laws of armed conflict, in which case we can have quite a sophisticated conversation with them. Or it might just be about general capacity development, including in relation to the rights of persons with disabilities or other groups. We provide our advice via various formats. It could be informal verbal advice over a coffee. It could also be more in-depth field training where we'll go out to the context and provide training to actors. It might be through provision of legal memos. So yes, as I said, it's very much so a tailored approach. In some cases, it'll be completely confidential and highly sensitive. In other cases, it's less so. So yes, really happy to work with other help desks, as I have mentioned to a few of you, where I can see that cross referrals could potentially be helpful. And yes, thank you again for letting me gatecrash. I'm very happy to receive any questions you might have about the help desk. I should say that we are a global team. So we do have colleagues in Jerusalem. I also have colleagues in Mali. We operate out of Lebanon, looking at Syria, Afghanistan, and other regional contexts there. And as of late, the focus of our help desk support has been on Ukraine.
Super. Thanks so much, Alice. And I feel like a community of help desk coming together with this launch of the help desk. So it seems that there's a lot that you can learn from each other and also support each other. And I think also really, if you get a question, it's like, oh, wait, this question, it could be better supported by the X help desk, that you've got that kind of network of help desks going a bit there. Perhaps I could ask you, I mean, Alice, obviously, because you're working in different countries, I imagine the language issue is kind of covered by that. But it's a question, I guess, to all of you, how are you identifying your experts? Is it that, I mean, with the GBV, AOR, Joanne, you were saying that you obviously got the community of practice there as well. Is it that you just get people who are interested and able and willing to answer questions that come up, and then you can match questions to them so that they can help follow up? Or how have you identified those resource people so far? I don't know, Alice, maybe if you want to start and then come to the others.
Yeah, sure. I mean, we are a team of 20 plus now, legal experts. So our support really is internal, and all of us work on the desk and will service the various inquiries that come in that are most relevant to our area of expertise. But yes, I completely agree with you about, it'd be a really, really good opportunity to maybe have a group of help desks so that we could tap into the various expertise within this group, at least because I know our help desk would certainly benefit from that additional layer of particular expertise. So I'd be very open to that.
Sorry, I was finding my mute button. Thanks so much, Alice. Karina, maybe in terms of the resource, how have you identified those experts that you have out there?
So partly we have the global education cluster staff, which are a number of expertise that we draw upon. But we also have a global partners forum with the people engaged in education in emergency coordination all over the world. That is also a network we can tap into. And in general, we find as the years have gone by that more and more global experts find us and want to engage. So it's not that we have, like a standing group of people apart from the global education cluster staff. But it's an active network, and it's the education in emergency is a very active community of practice that we engage very strongly with, and through that we identify experts.
Super, thanks for that. And Gula, maybe I'll come to you in terms of how you're planning on managing the help desk and the experts there a bit, but also how do you define an expert? I mean, is it that somebody says, I'm an expert in this area, I want to help, or is there a vetting of experts?
So in terms of the provision of technical support and policy guidance from the ISC platform, my position provides that guidance. And similarly, from the Office of Special Coordinator, the plan is that someone senior who has been working on that position and has a good understanding and knowledge of the work would be handling directly the requests and queries from the field. And that's how we plan to manage the provision of policy guidance and support to the intra-agency PSA coordinators in the field.
Super. Thanks very much. And Karina or Alice, did you want to come in terms of when people kind of approach you as experts? Is there any kind of vetting, or do you take them for their word or do you take them through a test run and make sure they answer the questions correctly?
I mean, no, I wouldn't say so, because the experts are the people who are hired by the Global Education Cluster, so standing staff, or it's people we have had a long work relationship with and worked with. They've been in our strategic advisory group, or these places. So it's people we know well, and again, maybe we have the kind of advantage that the education in emergency coordination community is quite small. So we tend to know each other, but we're definitely always welcoming new people who want to engage with us.
Super. Thanks so much. Are there any last things from those of you on the help desk, or there was a question around, a help desk that could be used for members, that could be for use of individuals from affected populations. And I know, Namita, you wrote that would be more at an individual level. In a way, it almost comes back to that broader question in the accountability world that's been there around as sort of an ombudsman almost for people who've been affected by crisis, but that's a whole other conversation. But have any of the help desks, do you get calls from people who are affected by crisis trying to get help from your help desks? Although they're quite specialized, I guess, so that wouldn't, maybe not so easy to find you, but has that ever been a thing? Although Joanne did say if they ever got a call from a survivor, they would make a referral. Is that something, Karina or Alice, you've come across?
Yeah, so we do on a fairly regular basis receive individual queries from persons within affected communities and affected populations. But that's unfortunately not a service that we're able to provide. We don't have the capacity for that, and it's a different type of service. So where we can, we will provide local referrals within our own network, where that person might be able to kind of access more pro bono individual legal support. Or sometimes where we see repetitive inquiries, we might go through a representative organisation, maybe an organisation of persons with disabilities, for example, to provide more general support on a particular inquiry, access to humanitarian service provisions, for example, in Ukraine. Yes, but unfortunately, we don't provide support on an individual level.
Interesting, but I think that referral option and seeing what you can do is always what's the way forward. Namita, do you want to come in and then Pedro?
Yeah, thanks, Manisha. I think it's important that we don't turn anyone away just because it is out of scope. It's important to acknowledge that request, but also mention that allow me to introduce you to this or refer you to this particular hotline or a help desk that would really cater to your particular need. And that's why just having a mapping of other help desks or country or regional level hotlines is very helpful to just quickly go there and share that information with that particular user. So I would say that, because this is an opportunity to connect them to other resources. So otherwise, from a user's perspective, they might just, if you close the door on them, they might just, go around a bit confused about how to get support. So I think it's good for us to be informed of what are the different channels that a user on ground in this particular situation might need. Thanks.
Super. Thanks, Namita. Pedro, please.
Thank you so much. I would just like to add that if an individual person affected by crisis anywhere in the world would like to initiate, let's say, a community-based complaints and feedback mechanism or some kind of grievance system, we would still be very happy to support and to provide the resources and tools that we have available. So we just need to differentiate. It's not a matter of individual people or affected people versus practitioners. It's more about what are you looking for. If you are looking for support for complaints, then you have appropriate outlines at country. But if you want support to develop AAP structures, community feedback mechanisms, or community engagement strategies, then we would be very happy to support. Thank you.
Super. Thanks very much. And Ghulam, before I come to you, just a huge thanks to you, Alice, for jumping in very last minute. I know you've got to go to another call, but I hope that all of you can continue to work together as Helpdesk now that you've met each other. And we're happy that we've created a little network of Helpdesk today, informally, if nothing else. So thank you, Alice, for joining us. Ghulam, please.
Just a quick addition. For sensitive complaints such as sexual exploitation and abuse, we have an obligation to report. So if, for example, myself or my colleague from the Office of Special Coordinator happens to receive a sexual exploitation and abuse allegation, we do have an obligation to report. That's how we handle the sensitive cases. And the reporting is to the respective entity for administrative action, including administrative investigations and referral to the GPV Child Protection Services. Back to you.
Super. Thanks so much. I know we're coming closer to the end. There was a question about, does a mechanism exist at global level to measure if the humanitarian system is improving on accountability to affected populations? I think that might be a little bit outside of the scope of this conversation. It's a great idea. And maybe because Jesse, you're here, you can take that one on as the task force for consideration moving ahead. I just wanted to, sorry, Pedro, did you want to come in?
I'm happy to come in if you deem appropriate.
Please. Sure.
Not sure if Jess wants to come in first. So I can just speak to a couple of mechanisms that we have in place at the ISC level. So just to say that, first of all, the AAP task force itself is not tasked to do this global monitoring, but the Interagency Standing Committee in general and OCHA as the coordinator for humanitarian affairs, they definitely are. So the AAP is actually embedded in the TORs of the different structures that deal with humanitarian coordination. So the humanitarian coordinators themselves, they are held accountable for the delivery of the AAP and inclusion and PSEA for that matter, and gender and all the diversities within their work. And likewise, the HCTs, the humanitarian coordination teams, the AAP coordination groups, the community engagement working groups. So all these structures, they have their own TORs, and the responsibilities are well set in what is expected to be delivered in terms of accountability and inclusion of affected populations. The same goes within the cluster structure. The different clusters, while doing their work, are also held accountable to make sure that the voices of affected people are taken into consideration and that their complaints and feedback is being listening and acted upon. So this is the way we are doing the monitoring. And this is the way that the different structures are being held accountable by the humanitarian leadership here of the Emergency Relief Coordinator. Back to you.
Super. Thanks, Pedro. And Jesse wasn't able to get himself off mute, but said that they'll take up the suggestion or the topic of some way kind of mechanism in the task force as well. I just wanted to see if anybody had any last comments before I wrap us up. Namita, please.
Yes, actually, this is something that I would like to alert our attendees. So next week, if you are attending the Humanitarian Networks and Partnerships Week in person in Geneva, come say hi to us. We have a booth in the exhibition area focused on the portal and the help desk. We would love to meet you, connect, hear what are some questions or what some feedback you might have on how we should operate. anything really, just come say hi and share your ideas and what accountability and inclusion means to you. We really look forward to taking this again beyond this 1.5 hour long discussion and continuing it. And that's right, it's booth number 6 at the Geneva Convention Center. Thank you.
Thanks for that plug there, Namita. Karina, I'd seen you had your hand up and then it went down. Did you want to come in?
Yeah, I think I just wanted quickly to say, I think it's important that a help desk has quite a clear mandate, that we don't try to cover too much, because I think the quality will suffer. So the clearer the mandate, the better service we can provide. That was just why.
Thank you very much. Ghulam, please.
So just to also complement what Namita has mentioned, we do have substantive topics under the Protection from Sexual Exploitation, Abuse and Harassment that are scheduled to be covered under the various HNPW sessions. So we do encourage you to join them to have a better understanding of what's happening in the PSU8 space, both at a global level as well as in the field. Back to you.
Super. Thanks so much, Ghulam. Huge thanks to all of you who've been on the panel. I think it's been really exciting to be here for the relaunch of the A&I Help Desk, and also to look again at the portal. And I think the conversation with the other help desks has been really helpful. Of course, because they're help desks, they're helpful. I think that issue about making sure that there's that safety to be able to ask any questions, that you've got that security and that confidentiality, that you're able to adapt the way the help desk is functioning based on feedback, and really adjust what you're doing and making sure that that's considered. Being able to also ensure that you are connected to that broader AAP community. But I think also, as we've seen in sessions from earlier this week, how do we also connect with the data community? Because there's lots of things that the data community could also be bringing in, or the social science researchers as well, that can contribute to that broader accountability to affected populations community as well. And in terms of staying on top of things, also really important to keep reminding people that the Accountability and Inclusion Help Desk exists, as you reminded us, Karina, so that you're telling new staff, existing staff, that it's part of sort of inductions when AAP staff are coming on board, so that they start to use it, that they also share resources with the portal so that everybody can contribute to that portal, and making sure that resources are readily available and tools are there as well. We will be sharing those list of suggestions for what the help desk could be doing. So thank you to all of you for including that in the poll there. And I think also the call that, experts that are out there do come to the A&I help desk and really help support them in terms of being able to provide responses, like has happened with the Global Education Cluster there. We will be putting up the answers to the Q&A along with the recording on the website. So I know we didn't get to all the questions, but we'll try and answer as many of those as possible, and we'll stay online. So Namita and Pedro and others, if you want, you can provide some answers that we'll put up on the website. I think also, just finally, it's also important to be able to adapt sort of how the help desk is responding based on the users, which I think is really critical as well. So with that, a huge thanks to all of our panelists, to Pedro, Namita, Joanne, Karina, Ghulam, Alice, who we pulled in at the last minute. So we were being adaptive and responding to what came through in the chat, just like a help desk would be. Just a quick reminder also that we would encourage everybody, obviously, to not only use the portal and the help desk, but to share those, share the fact that they exist with your colleagues. So really just disseminate and tell people about it. So spread the word about the new help, or the relaunched help desk and the portal, and make sure that you're also really providing resources towards the portal. Feel free to write some blogs, or, share resources that you have in whatever language there may be there. If you feel like translating, please offer that service as well. And I think just join the help desk community of practice, because as we've seen with the other help desks, that linkage with the broader community of practice is really critical as well for the help desk to be able to respond to the needs of those experts and technical or individuals who are looking for help from the help desk. Thank you, Pedro. I did say thank you to all of you, sorry. Just a quick reminder of the other sessions on AAP that we've had this week. Every contact counts, humanitarian data responsibility, leveraging social sciences, and empowering frontline staff are all or will be shortly up on the website of PHAP. This one will also be up, the recording with the questions and answers. And please join us on Monday for the hybrid session in person in Geneva or online on what should we change for greater accountability to people in crisis. That'll be at 4:00 on Monday, and I will be there in person. So I look forward to seeing some of you. Huge thanks to everyone in the audience, to the ISC AAP task force. Also, I didn't say thank you to you, Jesse. Sorry, I didn't update my run of show at the last minute. I apologize. So thank you, Jesse, as a co-chair of the task force, for joining us. Thank you to UNICEF for supporting this series of events on AAP at HNPW. Thank you to all the PHAP colleagues in the background, and we look forward to seeing you hopefully on Monday. Thank you all.